I'm an interventional cardiologist, and actually I've been practicing medicine now for about 20 years. Trained at Tulane, New Orleans, did my internal medicine, cardiology, and cardiology fellowship there. And moved to Huntsville about 18 years ago, and ever since I've been in private practice here. Initially, when I started to investigate personalized medicine, I really relied a lot on phenotypes and genotypes to make clinical decisions or try to identify these patients that were having these, what I felt was adverse drug events. But the more I began to investigate, I began to realize that it was really medication reconciliation that unlocked a lot of the answers to the patient's complaint. I would see patients who were on duplicate medications, patients who were taking the inappropriate dose, patients who were actually taking over-the-counter medications that were bringing habit or responsible for a lot of the complaints that they had. I realized that the phenotypes and genotypes were very important, but just simple medication reconciliation made a huge difference. And the power is when the physician takes a look at not only the medications, but if you can take that and combine that with genotype testing, it really makes a huge difference in the overall outcome of the patient. As I got more involved, as I saw more patients with complaints, my whole approach to the patient and managing that patient changed. We were all taught, again in medical school, that when a patient presented to the office with a complaint, we wanted to start that patient on a medication. And that's the way 99% of physicians practice medicine. But now when I see a patient, as far as I'm concerned, one of those medications are guilty or responsible for the patient's tachycardia, dizziness, lightheadedness, passing out, change in mentation. So instead of starting the medicine, I start stopping medicines. I cannot tell you how many patients that have presented for many months with disabilities, and as a result of a drug-drug interaction, you stop 4 or 5 of the medication, the patient improves, and most importantly, a lot of our patients on fixed incomes. It makes a huge, or has a huge impact on their overall financial well-being. So it's really, it's a win-win in so many different ways.